Hello, and welcome to the first ever episode of Uptime, the podcast from .med Healthcare Business News, where we talk to experts about the key issues impacting the medical equipment industry. I'm your host, Carrie Stevens. Before we get to our interview with Matt Baretich, let's take a quick look at the news. We're now talking on Monday, November 24th, and one story that's already generating a ton of interest is GE Healthcare buying Intelerad for $2.3 billion. And yes, that's absolutely going to be a hot topic at ours tonight at the end of the month. Now, it's my pleasure to introduce Matt Baretich for a timely conversation about what HTMT needs to know ahead of the January 1st Joint Commission updates. Matt, to start, can you just please tell listeners about yourself and what you do?
Oh, right. Well, I'm a clinical engineering consultant, and among the various things I do under that umbrella is work with HTM programs. In fact, in the past, I've always said across the country. I'm now located in Canada, so I do some work in Canada as well as in the U.S. and help HTM programs assess what they're doing in terms of accreditation and compliance with regulations and other operational aspects. So that's where most of my time gets spent.
Okay, so let's talk the Joint Commission. What is going on January 1st? Can you talk about that kind of in a broad sense?
Yeah. I'm sure everybody who's got accredited by the Joint Commission has been hearing about this. And what's behind it is, let me start from the sort of the big picture. There are a lot of, it's not just HTM that's changing in the Joint Commission standards. It's everything across the board for hospitals and also critical access hospitals, those small rural hospitals, but for hospitals. And the underlying change is that Joint Commission is aligning much more closely with CMS, the Centers for Medicare and Medicaid Services. CMS is a major payer of hospitals through the Medicare and Medicaid programs in the U.S. And so, anything that CMS wants, Joint Commission, hospitals have to pay attention to, and Joint Commission needs to follow. And over the last several years, Joint Commission has become more precisely aligned with CMS, but there were still some opportunities to change that. And I don't know all of the things that went on behind the scenes for that, but the result is that the Joint Commission standards look a lot more like just repeats of the CMS regulations. And in the process, um, well, in the process, the Joint Commission has been advertising this as a way of simplifying the requirements on hospitals, all across the hospital, not just in HTM. And I'm going to go out on a limb here and say I don't see it that way. I don't think that they've in fact simplified what we're required to do. They've just sort of hidden some of the requirements in places that we didn't know to look before. And we can talk about some of those details
Yep.
going forward.
Okay, so, what new documentation details will surveyors expect HTM teams to produce?
Yeah, so let me just jump ahead to the bottom line. I think most bottom line of advice for listeners is that I think all of us who have been accredited by the Joint Commission for a long time have developed good quality medical equipment management plans, the MEMP. And what we're going to do going forward, I recommend, is not change those anytime soon. Just continue to follow those through. What changes is, for example, where we had a lot of EC standards that we would refer to in our MEMP. Many of those are no longer official standards. And so that's where Joint Commission gets away saying we simplified the standards. However, they've put them elsewhere, and I can talk through some of the places that they have put them. But
Yes, please. Yeah.
the bottom line is really just that we're going to need to continue that work. And I'll give you an example in answering your question about additional documentation. Sometimes when we would document some of these activities in certain ways, um, instead, what is going to happen is there's going to be an expanded sort of interview process from the surveyors. So we can expect much more in-depth kinds of questions that come from surveyors. So our documentation, if you will, is not in the MEMP. It's more, I have to have an answer for the surveyor when the surveyor asks a question. But I think in practice, it's not going to be a lot different from what we do now, but it is really confusing
Mhm.
about what where they have put the different requirements. So I guess my message at this point is don't assume that because you can't find something some requirement you've been working on, and don't assume because you can't find it that it went away. It could be hidden someplace else. So that's why my advice is don't change anything we're doing for at least several months into 2026. And so I would advise too that you check with your colleagues in your hospital system or um, in your neighborhood and find out who's going to be surveyed in the first few months of 2026
Okay.
and just plan to contact them afterwards and find out exactly how it went. So we're speculating a little bit right now.
Okay, so do the updates tighten how AEM programs are judged and like what evidence will HTM teams need to have on hand if they do?
No, the way I read it, it is not. It is
Good.
not.
That's good.
Uh, so it's really just shuffling things around in the different locations. And who knows? At some point, there may be some change in the requirements, but
But not yet.
I don't see them yet. Having said that, in a larger hospital picture, there are big changes in how nursing and medical care and other things work in terms of reporting, breaking down silos between different groups, and other things I think are good directions for Joint Commission to do. I think there was a tendency to focus down on a particular department and not look at the big picture for patient care. So all of our colleagues in the hospital are going to be scrambling to try to put these into place. Fortunately, it looks like we've been left alone on that. I think the one thing we can take from it is we should be thinking, particularly when we're talking to the surveyors, is to not be too siloed in how we answer something. So, for
Okay.
example, if the surveyor asks, how does the hospital how does the hospital do an AEM program, for example? And if I say, well, the equipment that I take care of, here's how I do it. But the lab takes care of its own equipment, and the radiology takes care of its own equipment, and you'll have to go talk to them to find out how they do AEMs. Surveyors, I think, are not going to want to hear that. They don't want to hear go talk to somebody else. I think you'll hear surveyors that turn around and say, uh, stop right there. Go get the lab director. Go get the person in charge of radiology maintenance and get them in the room here so that we can answer this question from a hospital-wide perspective rather than just what you do in your department.
Well, that's interesting. And so, can you talk more about? I mean, this is not definitely specific to HTM, but more of the changes in regards to nursing and all of that and the other teams in the hospital.
Yeah, I haven't looked closely
Care.
into that. What I'm seeing though is there's more um, direction to have communication across different departments and also at the same time putting more responsibility on upward level maintenance, excuse me, maintenance, upward level administration. including the board of directors. And so, in the past, um, board of directors didn't get very hard questions if they were interviewed at all. And now they're going to be, did you look at this? Did you ask this question of every component of your healthcare system, not just the big city hospital, but also the rural hospitals that are part of your system? How are you as a board directing the system to be focused in an integrated way across departments to do good patient care? So that's a good thing. But I think organizations are going to be struggling to say, adapt their communication processes and their meetings and so on. Um, I guess you could say maybe it's an opportunity for us in HTM to reach out to our clinical colleagues
Yeah.
and explain what we do and say how we can be helpful and just realize that they're under some pressure now to show how they integrate across the system and can't just focus on their narrow concerns.
No, I think that's been something we've been hearing a lot in the industry. It's like people, are trying to get the HTM teams to not be so siloed, to be more, because it is such a integral part of the healthcare system. But I think the problem is people don't even sometimes even know really what the biomeds do.
Yeah.
They think
No,
yeah, they think, you're in the basement doing that. But I think this is definitely a way it could be an opportunity for the HTM teams to really show who they are. Like you said, work with the other clinical teams and, stop being so
yeah.
siloed. That seems interesting.
Yeah, over the years, I've used the phrase "think outside the basement," and I think we have
Yeah,
an opportunity to do that.
it's
Is
interesting.
to not just think about our narrow role, but get out there and communicate. Spend more time in the clinical environment. Integrate with nursing staff. Get them to see that we're part of their team.
Right.
And when we do that, I think it's going to make our day-to-day jobs easier. But uh, you know, the other thing I see, and I've seen for a long time, you've probably seen it as well, is that um, there are some problems that we need to solve in the organization that we can't solve by ourselves. And so going to, for example, the safety committee or EOC committee, which will still exist in the future, but it'll have a different name probably. But there's going to be some group out there that's a multidisciplinary group. And once you're accepted, you're not just somebody that reports on the PM completion level every few months. You're somebody who's brings issues to the group and says, "Here's something that's important to the hospital. I can't solve it myself. I need everybody in this room to come up with ideas and be part of the solution." So I'm hoping that this sort of opens up an openness to that kind of discussion and gives us an opportunity to think more broadly.
Absolutely. No, I think anytime someone hears about a joint commission update or, changes, it can be nerve wracking because it's like, okay, now what, and especially with the deadline of January 1st, I'm sure there's some stress with that.
Yeah,
But I'm glad you're saying that this is actually an opportunity for teams to really work with their clinical partners and, show who they are, what they do, why they're important. I think that's a really positive way to look at it. And I'm glad to hear that.
yeah. So I think in practical terms, I would say you can just continue with the MEMP that you have in place, keep doing everything in it. The only thing that will suggest you might want to do is the following. Many of us have put together the MEMP document with reference to particular EC standards and elements of performance. So EC.02.04. Something or other, element 3. So that's about some kind of aspect of AEM program. if I'm remembering rightly. I'm probably not remembering exactly, but you know what I mean. There's a number out there, and we refer to it in our documentation. Well, that EP is disappearing, but
Okay.
the requirement is elsewhere. So you might want to just, X out the actual standards references, but keep all of the work that you're already doing, and I think that will serve you well going forward.
No, that's great. Okay, so I think we've talked enough about this, and I'm so glad that you came on to explain this to people because I'm sure they're gonna have a lot of questions with the January 1st deadline. But one thing we're gonna be doing with the Uptime podcast is I will be asking all guests, what is something in the HTM industry that is keeping you up at night? And can we talk about that? So what is keeping you up at night?
Mm,
It's
mm.
in relation to the job, the industry.
Yeah, that's a great question. So sort of the answers I'm guessing you'll get from people who are more knowledgeable in these areas than I am. One is about acquiring and retaining good staff
Right.
members, and I'll let other people talk about that. Um, and cybersecurity is another issue, and I'll
Sure.
let other people talk about that as well. Deeper issues. It's something that always is an issue for me is that I think we in the profession tend to keep ourselves in a reactive mode
Mhm.
where we wait for a joint commission to come up with some big overhaul or or any other thing that's going on in the field, any other standards making group, for example. And then we just have to react. We scramble, with a few months, we're saying, wow, the standards manual got torn up into bits, run through a shredder, and thrown around the room, and we got to try to put it back together again. Well, what a waste of time that is. I'm hoping that we can find, as a HTM profession, a way to be more proactive and be more involved in the standards making process and more influential in government and just leading some of this because we're the experts and we have practical knowledge. We're not the only person at that table, but we ought to be at that table, and we really aren't very effectively. I mean, we look at. I want to say some positive things about these organizations because I really do think they are positive. But for example, AAMI, Association for the Advancement of Medical Instrumentation, which I love and am very active in and does lots of great things, explicitly by their charter are not an advocacy organization.
Right.
So they can't go out and lobby for this or that kind of a change. The American Society for Healthcare Engineering, ASHE, is an active advocate for healthcare facilities, but not in the biomed world, not in the HTM world. They're more in facilities, and they have had some significant successes over the years of advocating for a change. They, for example, went up a few years ago against a big change coming from CMS about fire dampers, and they just said this is over the top, but they were able to come back with. They had a letter writing campaign, they had a lobbying campaign, they collected lots of data, they presented it in a professional manner, presented it as a group, and CMS backed down. And we have in HTM world have never been successful at that. I mean, I wish that we would have been able to do that in the AEM changes that came along before. So I think I don't know what the answer is, but I think that as individuals, we can all take opportunities to sit on standards making committees. And I think we should talk to the different groups that represent us or could represent us and say, we'd like a little more a little more representation rather than just, whatever you're focusing on now. We need some advocacy. And that, I think, in a longer term way, is really going to benefit the HTM community, that we can bring our expertise to improve patient safety, um, and not always be in this reactive mode that takes a lot of work and requires a podcast like this to explain what happened to the darn standards.
No, I think that was an excellent answer, and honestly, one I haven't heard of lately. So, thank you. You were
Yeah,
a fantastic first guest, and to our listeners, thank you so much. And be sure to check out the next episode of 8 Uptime. Thank you.
thank you.
Um,